Today in Fox Health, we're focusing on the importance of your dental health. Joining us with some tips is owner of Norton Family Dentistry, Dr. Jario Norton. Good morning.
Good morning.
Yes, sir. So this morning we are talking about toothbrushes. What do we need to know when it comes to toothbrushes when it refers to soft bristles and hard bristles?
The key thing is that just because it says medium or hard bristle doesn't mean you're getting the job done better. Soft bristles work the best. They cause less pain or less gingival irritation, and they also keep the gingiva healthy, and they are also strong enough to remove anything that you need to remove off your teeth, especially plaque, which is the #1 thing you're trying to remove. Just because it says harder or stronger doesn't mean it's better.
So that's definitely a misnomer that you're clearing up this morning. Many people think that harder bristles on a toothbrush means that it's cleaning better.
No, it's more so how you use a toothbrush. You want to brush in circles and make sure you're covering all the tooth surfaces. Harder can actually be damaging to the gum tissue, causing them to recede away from the tooth, getting into more sensitive areas of the tooth. So once those areas are exposed and you drink anything, liquids, anything like that, all of a sudden you feel this more of a sensitive pain to your teeth. Any pain that's in a tooth, any feeling that's in a tooth is always transmitted as pain. Teeth can't itch, they can't get any other feeling other than pain. So once you expose that area of the tooth, you're more likely to have more sensitivity in that area.
When it comes to manual versus automatic toothbrushes, is there one that dentists prefer patients to use?
We prefer you to use the one that's working the best. So when you come to the dentist, if we see a lack of tartar and not too much plaque, that means you're doing something good at home. It's almost inevitable. You're going to have some plaque on the teeth. It's something that forms on the teeth every few seconds called a pellicle. You have to remove that. And there's no way to get rid of all the plaque. But if you come and we see that you're doing a good job brushing whatever toothbrush you're using, if you don't have the dexterity, as we call it, to make the hand movements that's needed to brush the teeth properly, then we suggest you get an automatic toothbrush. But if you can do just fine with the cheapest toothbrush that you find with soft bristles in Walmart or wherever you want to shop at, long as you're getting the job done and brushing in circles and following your gum line.
Wow, so that Dollar Tree toothbrush is doing just the same job as that $150 toothbrush.
Exactly. My whole life I probably had a Dollar Tree toothbrush with soft bristles, and it's worked just fine. It's just making sure you're using it properly and using it at least twice a day. It's a key thing that you want to brush for at least average 2 minutes a day, twice a day. So 4 minutes per day, making the right movements, getting the right areas of the teeth, and you really can't go wrong.
Got you. So when it comes to replacing your toothbrush, I know when we go to the dentist, we get the free toothbrush every 6 months, but should we be replacing it before then?
You should replace it according to the ADA every 3 to 4 months. Of course, if you haven't, when you come to the dentist, we'll give you a new toothbrush every 6 months. Some people come more often, but we only give them every 6 months. But 3 to 4 months, or also when you see the bristles of your toothbrush start to give out, you may want to replace it even quicker than that. But you definitely want to have nice bristles, not hard or medium, soft bristles, but ones that are upright that you can, kind of tell when your toothbrush is giving out. That'll get the job done.
And lastly, Dr. Norton, before we go to commercial break, toothbrush covers. I know that's something that's talked a lot about in the dental community. Some people saying we need to have toothbrush covers because we don't want fecal matter and other things in the bathroom to get on our toothbrush. Is that the right thing to do?
Well, you actually want to, after you get through brushing your teeth, you want to rinse off your toothbrush in warm water and sit it upright. But you don't want to put a container on it too much because that's going to store the toothbrush in a moist environment, and that's going to invite other bacteria in. So you actually want to leave it out in the open so that you don't create that bad environment for your toothbrush.
Always a pleasure having you on our show, Dr. Norton. Thank you so much for being here. And all of this great information Dr. Norton just shared can actually be found on our website, arclatexhomepage.com. Let's take a live look outside right now from our